In Chapter 13, we're going to cover the nutritional requirements that affect women during childbearing years. Primary factors for a successful pregnancy are to have a healthy nutritional status before you conceive, to maintain appropriate weight gain throughout the pregnancy, and an adequate intake of essential nutrients during your pregnancy. We would like for an infant, a child, to reach full term, which is 40 weeks, and a mature birth weight. In 2014, approximately 34% of all infant deaths were born at less than 32 weeks gestation. So beyond 32 weeks is ideal if possible. Some of the different things that can affect pregnancy malnutrition during pregnancy can be anemia, preterm births, preeclampsia and eclampsia is a problem. Postpartum complications can occur later. Long-term adverse effects can occur from these things to mom and baby. So there's a lot of different things that can come from malnutrition, impairment of growth and development in the child, birth defects, cognitive and behavioral impairments, things like that. So we talked about being in a healthy nutritional status prior to conceiving. And then this is also the most important time for prenatal care if possible. We'd like to address any weight issues prior to conceiving. Preeclampsia can be a problem if weight isn't maintained and blood pressure isn't controlled. Folic acid intake, it's important to get enough folic acid. Remember, we are typically required 400 milligrams a day, and with a pregnant woman, we up that 200. Deficiency can result in those neural tube defects. So we definitely want to have that on board as soon as we know we're pregnant, or if you're planning, typically the OBGYNs will have you take that about 3 months prior to conception. Iron and folic acid deficiencies have been linked to premature births as well as stunted growth, and iron and calcium deficiencies can deplete mom's stores and lead to an infant store being suboptimal at birth. Unusual dietary patterns that we can see that can affect fetal development. Pica, some people refer to it as pica, is an abnormal consumption of specific foods or non-food substances such as paint chips, dirt, and clay. Some of the risk factors for this condition are lower socioeconomic groups, less than a high school education, maybe poor nutritional health, behavioral or environmental factors such as substance abuse, and sometimes nutrient deficiencies. Iron, things like that can cause people to have these odd cravings. Some cravings that pregnant women may get could be cultural or regional or due to poor nutrition. I had one student that said that while she was pregnant, she craved dryer sheets, Gain dryer sheets, and she would tear off little pieces and eat those dryer sheets. So that's just an example of some of the strange patterns that you can see in people with this condition. As far as inadequate prenatal care, it could be a healthcare access issue for mom and baby. And if a woman is not getting adequate prenatal care, that could lead to chronic health problems later in life, not only for her, but for baby. Gravidus is a term for a pregnant woman. So the age of the pregnant woman, such as adolescence, can increase the risk for a low birth weight baby. Majority of adolescents, as we've talked about before, are low in calcium and things like that because they don't drink milk like we did. They drink soda and they drink sports drinks and things like that, high caffeine. So a lot of the adolescent pregnant moms are deficient in calcium, iron, vitamins A and D, possibly niacin, and kilocalories. 1 in 3 teenage moms will show a sign of significant bone loss, and women that are ages 15 to 24 are recommended to take vitamin supplement because of this. We also are seeing a lot of women having children later in life. So we're seeing those pregnancies after age 35, which puts you more in a high risk category. And some of those risks are diabetes, high blood pressure, cardiovascular disease, and a risk of Down syndrome to the child. These are a couple of great informative slides. How old is too old to have a baby? The pros and cons of late motherhood. This chart just kind of tells you some of the pros. Why some of us are waiting later. We have more income, benefits to development such as language, greater access to health care, the wisdom that comes with age, we hope, more stable lifestyle. Many people feel that they're more ready for the responsibility of motherhood, less regrets on missing out on things in life, a stronger identity in knowing who you are. And many older parents report being calmer and more able to deal with the turmoil of a child. Some of the cons as you get older, lower energy, not being able to see children's lives beyond early adulthood, missing knowing and helping raise your grandchildren. Some children report being embarrassed by older parents, social stigmas, may not be able to conceive if we wait later in life, an increased risk of miscarriage, Down syndrome children, or chromosomal abnormalities. Weight gain. This is always a huge topic of discussion with pregnant women. Women that become pregnant in a normal body mass index range during the second and third trimesters, a healthy weight gain is 0.8 to 1 pound per week. Total weight gain should be between 25 to 35 pounds. If a woman does not gain enough weight, it can be associated with a low birth weight baby. And then excess weight gain can be associated with high blood pressure, miscarriage, stillbirth, and difficult deliveries. Children are more likely to be overweight at age 3 if the mother gained excess weight. So if a mother gains excess weight while she's pregnant, that does not mean that the child will be overweight, but there is a little bit higher risk for that. And they're just looking at a child at the age of 3. Oral health factors. Slightly more than half of pregnant women receive dental care during their pregnancy. I believe this is because of the fear of, probably one of the biggest fears is x-rays, not to mention if they have to have any dental work done and would have to receive anesthesia. I think moms are afraid to be around anything that could harm the child or put anything foreign in their body while they're pregnant. So attitudes are influenced by that fear of harm. Routine dental care during the second trimester, which is the gestational weeks of 13 through 21, has not been associated with increased risk of serious medical events, preterm deliveries, spontaneous abortions, or fetal deaths or anomalies. So that middle trimester is probably the safest time for the woman to come and have work done. Many of my patients, I would see them for just the cleaning. I had quite a few moms that had lots of bleeding, which is common. The hormones that are flooding through our bodies when we're pregnant can increase the bleeding. So I would have them come and we would just do a prophy just to kind of keep their gums and tissues under control. Really, really important for women to have good oral home care during this time and during lactation when they're breastfeeding. An intensive oral hygiene regimen may decrease gingivitis and periodontal disease during pregnancy. So preterm labor is 7 times more likely in mothers-to-be that have period disease than with women with healthy gums. That's kind of an interesting fun fact, and I had lots of women ask me that question. So keeping their gums and bone healthy is very, very, very important. Like I said, the hormonal changes, the estrogen and progesterone that's flooding through the body can increase our susceptibility to gingivitis and periodontal disease. So those, like I said, can be a risk for preterm delivery, preeclampsia, and low birth weight. Something else to think about with women and their oral health is the nausea and vomiting, if they happen to have that, or even GERD. That can lead to dental erosion. So we want to make sure that we inform them how to care for that, and that if they do have vomiting episodes or GERD, they'll want to use sodium bicarbonate or baking soda to kind of brush around on their teeth. Or after an episode, you don't want to go take toothpaste and a toothbrush and rub around, because that can worsen the erosion. They actually need to wait like 30 minutes before they brush with a toothpaste or anything abrasive. Baking soda can neutralize the pH of the oral cavity and help prevent some of that erosion. Some drugs and medications that need to be considered when we're pregnant. Caffeine is a big one. We all love our coffee and our diet sodas and things like that. It has been shown that more than 7 cups a day of coffee can be associated with low birth weight babies or a risk of miscarriage. So pregnant women should not consume more than 200 milligrams of caffeine per day, which is less than 2 cups of coffee. When they're talking 2 cups of coffee, they're talking cups of coffee, not mugs of coffee like I drink. So you need to be aware of that. Alcohol is a folic acid antagonist. So you've probably heard of fetal alcohol syndrome. Fetal alcohol syndrome is due to the fact that alcohol is fighting that folic acid, which helps in neural tube development and things like that. So if folic acid is not available, then it can lead to birth defects in the child. We should consult our healthcare provider before taking any prescription or over-the-counter medications, or even herbal remedies, because many of those things do and can cross the placental barrier and affect the fetus. Artificial sweeteners has always been kind of a controversial topic too when you're pregnant. Non-nutritive sweeteners that are generally recognized as safe can be used. When they say generally recognized as safe, that doesn't mean that they can't cause a problem. It's that it is not often seen. So saccharin falls under that, the asulfame potassium, aspartame, which if they're a PKU person or phenylketonuria, they should not take it. Sucralose and neotame are the ones that are generally recognized as safe. Another thing to consider when you're pregnant is pregnant women are at higher risk for foodborne illnesses. So you want to make sure that you don't eat fish that are high in mercury, sprouts, I believe, different things that are common to foodborne illness. Make sure meats are fully cooked. Don't eat raw things, non-pasteurized things. So if a woman would contract a foodborne illness, it can lead to miscarriage, premature birth, stillbirth, or an acute illness in the newborn. Toxoplasmosis is caused by a parasite, and it is the leading cause of death related to foodborne illnesses in the United States. So you want to make sure that when you are preparing meals that you are clean, your hands are clean, the surfaces where you're preparing the foods are clean, you separate raw meats from vegetables. You cook things completely to the temperature recommended, and then after you're eating, those items go right in the refrigerator and don't sit out for long. The things, like I was discussing, that you should avoid are unpasteurized juices, milk and milk products, raw sprouts, raw or undercooked meat, poultry, eggs, fish, and shellfish. So severe nutrient deficiencies can result in cleft palate and cleft lip, and possibly even a shortened mandible in the fetus. Nutrient availability affects whether teeth achieve optimum genetic potential. So by the 6th week of pregnancy, tooth development is already beginning in the baby. And then by the 4th month of pregnancy, calcification of those baby teeth starts and the mandible is calcifying. So 60% of calcification of the 52 deciduous and permanent teeth begin during gestation, which is amazing. Severe irreversible damage can result if there is a nutritional deficiency, excess occurs, or infection during critical stages of dentin and enamel formation. So many times when you look at an adult's teeth or even a child's teeth and you see malformations or pitting or things like that, that happened obviously while they were forming. The teeth are dependent on vitamin C for that collagen matrix to be laid down. And then calcium, magnesium, phosphorus, and vitamin D are necessary for the mineralization or the hardening of that matrix. So if an infection occurs, it can disrupt that calcium and phosphorus balance, which can then affect the tooth development in the fetus. As far as fluoride goes, minimal benefits to a fetus have been shown. So fluoride supplementation is not recommended before the age of 6 months. Dietary reference intakes for pregnancy indicate advisable nutrient intake for optimal health of mother and fetus. So they are a little bit different, not a lot. The amount of calories that we need, I know when you're pregnant and you're hungry all the time, it seems like you need lots more calories, but we really don't. Actually, in the first trimester, our energy needs do not increase at all. But there is a need for an additional 340 calories for that second trimester, and then an additional 452 for the third trimester. So making wise food choices of nutrient-dense foods are needed and necessary to meet those nutrient requirements. Fat, as far as fat goes, your serum cholesterol and triglycerides are going to be significantly elevated during the second trimester. And that's due to the development of the baby. The brain and spinal cord are dependent on fat. That's why we're going to talk later, children up until the age of 2 need to drink whole milk just because of the fat due to that development. We do require an additional 21 grams of protein, 67 grams daily. It can be achieved by consuming 3 ounces of meat or a meat substitute. So typically we would need 46 grams a day. With that additional 21 grams, that makes a total of 67. So 3 ounces of meat or a meat substitute, or 2 ounces of meat and an 8-ounce glass of milk could constitute that additional protein. Calcium and vitamin D are going to be very important. There are physiological changes that cause an increased absorption of calcium and vitamin D. The additional intake is not recommended for anyone except for teen moms, because pregnant women 19 or under may require 4 cups of milk to provide that necessary 1,300 milligrams a day, because many of them are deficient in those vitamins. The B vitamins, their requirements are based on energy or caloric intake. So B9 is folate, And the RDA for pregnant women, like I said, is 600 micrograms. I think I said milligrams earlier, it's micrograms. 50 to 70% of neural tube defects can be prevented with adequate intake of folate. Folate is best absorbed in the supplement form, and in the supplement form it is called folic acid. So in this particular instance, the supplements are okay, they're good. Your body will absorb those and use those well. Since the implementation of folic acid fortification in the United States in 1996, neural tube defects have fallen almost 35%, so that's huge. Iron is another important micronutrient. The recommended daily allowance is 27 milligrams per day. A higher intake of iron during gestation is needed due to the increase in red blood cell and production and the placenta. We need to compensate for the cord and blood loss that will occur at delivery, and account for fetal erythropoiesis, which is the formation of the red blood cells in the fetus. That's going to occur at the expense of mom's iron stores, so it's important that mom has plenty on board for her and baby. Absorption will increase from 10 to 20% to 25%, and vitamin C helps with the absorption of iron. So taking those together is a good thing. Iron can lead to constipation, which is a problem for pregnant women anyway, so that's always an issue that has to be addressed. Iodine, as you guys know, is associated with thyroid health. Iodine is necessary for the production of thyroxine, so it is recommended that 220 micrograms per day are achieved during pregnancy. 21 to 44% of pregnant women have inadequate levels of iodine during their third trimester. It's very important that we get enough of that for thyroid health. Thyroid can affect a woman's ability to conceive. It affects our metabolism, and just really important to keep healthy thyroid. Vitamin and mineral supplements. So the Institute of Medicine concluded that iron is the only nutrient that warrants global supplementation, and it should be identified on the nutritional need of the mom. Those at high risk for this need of iron supplementation would be adolescents, if a mom is carrying more than one fetus, or if the mom is a smoker, drinks alcohol, or uses other drugs. So the dietary intake and education takeaways from this: prenatal nutritional care improves pregnancy outcomes. Choose My Plate is a wonderful resource to give to new moms. They can not only find information on nutrition during their pregnancy, but also for nutritional information for infant, baby, toddler, etc. Some pregnant women may have little or no nutritional knowledge, so these resources are priceless. Nutrient intake needs more attention than weight gain, and breastfeeding should be promoted during pregnancy. Low-income women can benefit from supplemental nutrition programs for women, infants, and children, such as WIC. We would like to try to identify any fad dieting, pica, or other risk factors in our patients so that we can guide them to nutritional health. Lactation is breastfeeding. It is the ideal method of feeding infants. Exclusive breastfeeding is recommended for the first 4 to 6 months up to a year. Addition of complementary foods usually begins around 6 months and up to 12. And breast milk is all an infant needs for the first 6 months for optimal growth and development. There are rare exceptions where maybe mom's production is low, the whole breastfeeding thing doesn't go well. I experienced that with my son. So it is not the only option. Babies can do very well on the formulas that have been developed today. Prolonged breastfeeding beyond 2 years can increase the risk for dental caries. When a mom is breastfeeding, she does require more energy. So 85 kilocalories more for every 100 milliliters of milk produced, which is approximately 500 kilocalories per day or more. Protein recommendations are slightly higher still than they were for pregnancy. So an additional 25 grams a day rather than 21 for a total of 70 grams of protein a day. And then some other nutrients that are needed would be your vitamins A, E, C, B6, B12, and riboflavin, and minerals such as copper, zinc, iodine, and selenium. An additional 1,000 milliliters a day or 4 cups of water are necessary while breastfeeding. And when you leave the hospital as a new mom, you're going to leave with a huge jug that they give you that has measurements so that you can keep track of your water intake and make sure that you're getting enough of that water. Huge benefit to breastfeeding, I will tell you, is it helps the uterus to shrink back down to its normal size. And for many women, it is key in losing post-baby weight. So similar to a pregnant woman, 3 cups of milk or dairy products fortified with D daily is recommended. Like we said, protein needs are even a little bit higher, so 6 to 8 ounces of meat daily. Foods that are consumed by mom while breastfeeding can affect the infant. So things such as onions and garlic, spicy foods, whatever you eat, they're getting. So you may pay dearly later if you have something really garlicky and the baby gets upset tummy or colic and is crying and gassy and all of those things. So those are things to think about when you're breastfeeding. Alcohol can impair your milk flow, and all drugs should be used cautiously when breastfeeding because that will pass through to the baby through the breast milk. Again, Choose My Plate website provides a lot of great guidance tips for nutrition. As far as oral contraceptives, nutrient absorption can be negatively affected by these. So if you're on the pill, vitamins B6 and B12 as well as folate can be negatively affected by those contraceptive agents. Progestins may cause weight gain, increased appetite, or altered carbohydrate metabolism. Changes in your blood fats can lead to an increase for risk of heart disease. There can be an undesirable decrease in HDL and an elevation in the LDLs, which are the lousy guys. So those are some things to think about when on birth control. And then we go to menopause. Perimenopause is that time where your body is starting to make that transition into menopause. Many times we'll see a loss of bone density. You'll hear women my age talking about hot flashes and night sweats, and sometimes it makes you moody. So all of those things can be signs and symptoms that menopause is just around the corner. Some of the symptoms of menopause are there's a decrease in production of estrogen, progesterone by the ovaries, which results in the termination of menses, which is the one huge benefit to menopause. Reduced estrogen can result in a decrease of bone density, and then bone loss is usually more rapid at early menopause and will decline later. So alveolar bone is a good source of calcium, so losses may indicate early osteoporosis. So those are things for us to consider when working with our middle-aged women. It also leads to reduced salivary flow. We can see gingival effects from menopause, such as atrophic or pale gingiva, dry, shiny edematous mucosa. Many times women of this age will have an exaggerated response to plaque biofilm, which will lead to an increase in bleeding, maybe a loss of dental alveolar bone height, decreased bone density of crustal and subcrustal bone. There oftentimes is an increase in body fat and a decrease in lean body mass. And hormone replacement therapy is controversial. It's thought to reduce the risk for osteoporosis, but some of the hormone replacement therapy can be a problem for estrogen-fed cancers, such as breast cancer. So some people are on hormone replacement therapy, some people are not.